This is All India Radio. In the weekly program Current Affairs, now we bring you a discussion on World Health Day 2023, Health for All. The participants are Dr. N.K. Arora, Chairman, National Technical Advisory Group on Immunization, and Dr. Rajinder Dhamija, Director, Institute of Human Behavior and Allied Sciences, and Omvesh Upadhyay, AIR Correspondent.
The World Health Organization was founded on 7th of April 1948. The principle that all people should be able to realize their right to the highest possible level of health. Every year, a different theme is selected, keeping in mind the global public health concern. World Health Day is a day to reaffirm our gratitude and appreciation to all those who work day and night to keep us healthy. It's also a day to reiterate our commitment to supporting research and innovation in healthcare. And today, to discuss on this in detail, we are joined by Dr. N.K. Arora and Dr. Rajinder Dhamija. So, Dr. Arora, to begin the discussion, I would like to know from you, what is this year's theme of World Health Day and how significant it is?
So, as you, in your opening remarks, you mentioned, the health is this year's theme is to reach everybody, health for all, and taking the health to everybody. And the whole issue is about access of health facilities, about the feasibility and affordability of health facilities. And that is the paradigm this year's World Health Day tells us.
So to add in this, Dr. Arora, we recently came out of the pandemic, if we can say, and we know how COVID-19 pandemic affected the global health. In a glimpse, if we can talk about India's performance in order to deal with the COVID, how the world widely appreciated it, be it how we put lockdown on time, the fast-paced manufacturing of vaccination, and then how the biggest vaccine drive was implemented and executed. Can you please share a detailed overview on that as well?
So, in fact, it is so relevant and timely that this year's World Health Day we are celebrating, and the theme is very apt, which applies to India. India reached 97% of the adult population, and the primary vaccination with COVID was done. Now that itself indicates that our access is almost universal, because if I am able to reach adults whom I have tried for the first time, and I am able to give COVID vaccine to 97% of my adults 18 years and above, I think this is a great feat, and it indicates that we are now in that stage to take off, that we are able to reach everybody. Take the most essential intervention, which was immunization for COVID, to every part of the country, every region, and howsoever remote it was. I am sure all of us are aware that in Arunachal Pradesh, the vaccine was delivered through drones, and even for less than 10 people, the vaccination centers were set up. Now, having said that, it has also told us where are the gaps. It has told us that during 2021, when Delta wave was there were issues about beds, there were issues about ICUs, there were issues about ventilators, about the oxygen issues. And so I think India has taken whole issue of COVID not as a tragedy, but as an opportunity to identify, and then also an opportunity to strengthen ourselves. And therefore you find now we have just looked at the national COVID program, and we find that, for example, oxygen is now available all the health facilities wherever inpatient admission is to be done. And for next several decades, we should not have any oxygen deficiency. Similarly, ICU beds and ventilators. I'm sure many of us do not know, when we started with the COVID pandemic, we had just about 12 or 13,000 ventilators. Today, functional ventilators are 76,000 across the country, and now we are manufacturing. So COVID has helped us to, on one side, the resilience and the capacity to reach everybody in this country. On the other hand, it has also told us that where to strengthen, where to focus, and how we should see that it is not only next preparedness for the next pandemic, it is also telling us that for our routine healthcare, what are the additionalities we need to do, and to see that all of us seek health with a matter of right and also as a matter of pride that the quality of health services are one of the best.
And here I want to bring Dr. Dhamija in conversation that we recently witnessed pandemic COVID-19 and amid the time we are living, be it in the context of global warming, be it in the context of the lifestyle that we are living in, what are some of the biggest health challenges the world is facing right now? Dr. Dhamija.
Thank you for having us and on a very important day for the healthcare workers, including doctors, paramedics and the nursing staff to celebrate World Health Day 2023. So we are very proud today. Let me talk about achievements first and then we will come to challenges.
Sure,
challenges are always there and they teach us how to progress. An Indian born today is expected to live longer and healthier life as compared to an Indian born on 16th of August 1947. This is the India's success story in the health sector. And this has all been possible only because of the national level ambitious initiatives by the various governments in the past, including the current one led by Honorable Prime Minister. We have been able to reduce and control many deadly diseases, including the polio, the smallpox, the guinea worm disease, and all these diseases which were deadly at the time of independence. And now we have the improved healthcare accessibility and availability across the different geographical areas in the country. We have been able to decrease in death rates, that is the mortality. If I'm correct, the life expectancy in 1947 was only 32 years and now it is more than 72 years in 2022. So that's double, just the 100% increase. So this is one parameter. We will go along many other improvements and achievements in the last 75 years as we celebrate Amrit Kal in this 2022. And we have a ambitious 25 years roadmap in front of us which tells us what are the things to be done to achieve many other goals, including the service delivery. You have talked about the challenges. Of course, the rural-urban divide is still there and the metro-focused healthcare deliveries are much more as compared to the rural. But we have come a long way and that way we are trying to bridge the gap which is almost now nearing and we hope that in the next 25 years we will be able to bridge that gap. Some of those challenges which you asked me could be service delivery, as I mentioned, the health financing, human resources. We still have the doctors to patient ratio of 1 to around 1500. The ideally it should be as per WHO 1 to 1000. The other information system, digital technology in the health, the important parameters in terms of non-communicable diseases. We are now the diabetic capital of the world and all these lifestyle diseases leading on to cardiovascular diseases leading to significant mortality and morbidity. So some of these challenges, I'm hopeful that in the next 25 years we will be able to overcome.
And since we are discussing about India's effort in the health sector, here I want to understand from you, Dr. Arora, that if you talk about Mission Indradhanush that was launched in December 2014, last year the Ministry of Health virtually launched intensified Mission Indradhanush 4.0. So can you please describe and explain about Mission Indradhanush and Mission Indradhanush 4.0 and how significantly has it helped us?
So this whole strategy of Mission Indradhanush has been praised and appreciated all over the world by WHO. And the whole philosophy is you reach up to every child who has been left out from immunization or those who have incomplete immunization. And this has led to over 90% of our children being fully immunized. Unfortunately, during COVID, there was a slight back and we have to accept that. And that was the reason that there were outbreaks of measles recently. But 0.4 is again the same issue that almost the whole country is covered under that. And this another philosophy of zero-dose children. So those children who have not received the first DPT containing vaccine or pentavalent, although they might have received BCG or birth dose of oral polio and hepatitis B, they are being identified. This is part of the international approach. And the whole issue is that before the end of this decade, we should have half the current zero dosers. Current zero dosers are around 6% at the moment. And I think we should be able to achieve this much earlier because I think it's a highest political will and desire that our prevention is better than cure. In fact, this Mission Indradhanush whole approach is to see that nobody is left. And this whole philosophy which Honorable Prime Minister said that every public sector program, it has to have 100% coverage and it is fulfilling that. The other issue of great pride again is that all these years our daughters and granddaughters were left out with a very important vaccine which is called HPV vaccine and which prevents cervical cancer in women. And that vaccine is also going to be introduced in the third quarter of this year, and this is going to be manufactured within India. So in the immunization sector, I think a transformation has occurred. I would give you a figure. In 2014, the vaccine coverage, fully immunized children were just around 59-60%. And today, again, we are reaching beyond 90%. This is a major gain, and Mission Indradhanush has played an important role. Another positive thing about Mission Indradhanush is that system strengthening has happened. Now, what does system? Rajendra Dhameja ji knows it better that he manages a system. The system strengthening means now we have a head count of every child. We know how to reach every household and every child. And what are the supply systems? How do we manage that there is no stock out when vaccination sessions are organized? And we are aware that what we have learned from COVID, that very soon the same COVID will be used for immunization also. So all in all, what we are witnessing that immunization is a flagship program for the whole sector. It is probably the best performing. But the important point is that this is also influencing and helping and teaching us how to reach every individual. And during COVID, that's how we were able to reach 97% of adults for giving the primary vaccination.
And Dr. Arora, on the same line, India is aiming to make our country TB Mukt by 2025, that is 5 years ahead of the global deadline.
Now the system has the confidence that if I want to reach anybody, I can reach the program, because that is access issue is very important, and the system has the resilience. And the another important component which has occurred during last 6-7 years, 8 years is that we have started using very intelligently, strategically IT for our health programs. This makes the program more efficient. This helps us to keep an account of whom we have reached and who are left out. And a very important component of any public sector program or otherwise also is accountability. So when I start using IT for my health delivery systems, distribution of services, identifying the beneficiaries and IT issues, accountability is built in. And if there is a crack anywhere, if we are not able to fulfill the requirement anywhere, we can catch hold of the system or we can catch hold of the individuals, and appropriate actions can be taken.
And in the hustle of life, what gets ignored at times is the mental well-being. So, Dr. Dhameja, I want to understand from you, because Dr. Arora was telling about efficient system and was referring you that because you run a system. Can you please share some details on this, that how India is making mental health a priority? We have seen a huge budget allocation for mental health especially. What's your view on that?
As the head of the Mental Health Institute in Delhi, one of the premier institutes, so we have seen a lot of innovations and a lot of programs coming up in the area of mental health. As you know that there is no health without the mental health. So this has now been a priority for the Government of India. And recently I was at the Parliamentary Committee on the Health, stressing on the mental health. And the Government of India in the last budget has allocated 120 crores for the national-wide mental health program called Telemanas. So through your program, I just want to highlight and publicize the number 14416. That is a national number. Anybody can call up this number to have a tele-consultation regarding the mental health issues. So this is 24/7 call center helpline, which is attended by a qualified counselor, either a clinical psychologist or a psychiatric social worker, who takes up the call, and it is now operational countrywide in 50 centers across the 30 states, including Delhi. And the Government of India believes that 80% of the problems can be addressed at the counseling level regarding the mental health issues. If the problem is not solved at the level of the counselor, then the same call is transferred to the psychiatrist in the service facility only. And most of the 99% calls are addressed at that level. And if even at the level of psychiatrist or the teleconsultation, the issue is not addressed or not solved, then the patient is brought to the hospital, whether it is the mental health hospital or the medical college nearby. So this 3-tier system is operational since 10th of October 2022, that is the World Mental Health Day. And it has been again a success story in last approximately 6 months. And in Delhi alone has thousands of calls been attended in our hospital, and this is something to proud of. And once again, I would like to highlight that number 14416. That is 5-digit number. One should always remember and disseminate to the near and dear ones and in the society so that people can take advantage of this. The other issue of mental health being given priority by the government is that many of the medical colleges have been upgraded either as a center of excellence by giving them the financial incentives for increasing their seats for the MD psychiatry or building up the capacity in terms of psychiatric social workers and psychiatric nursing and clinical psychology. Not only this capacity building, the capital grants have been given up to tune of 30 crores to build up the infrastructure, whether building up the new buildings in the OPDs or in the wards. So that way, the upgradation of the existing psychiatric department in the medical colleges have been done, and that is going on. The other thing is that the public awareness and mental health literacy has taken a front seat, and now we are trying to destigmatize the mental health issues in our society so that people are not afraid to come to the hospitals being a stigma of mental health, and we are trying to reach to the houses or at the doorstep by providing them the mobile mental health units. That is also a priority of the Government of India so that everybody who has a mental health issue gets an accessibility and availability of the services either at the doorstep or by the telephone or at the nearby hospital.
To you, Dr. Arora, I want to understand, when we talk that healthcare for all, can we say that Indian government is ensuring that through Ayushman Bharat mission?
In fact, Ayushman Bharat is going to be a game changer. Over 45 crore cards have been kind of given out to people. And in fact, somebody told me today morning that every person with Ayushman card is like carrying 5 lakh rupees in her or his pocket. Now, this is a huge confidence that the person is able to get healthcare, quality healthcare, wherever you are in the country. So this is something, and I'm sure it is being taken up in a campaign mode so that all the eligible people who require support for healthcare, who require financial support for healthcare, they get their cards paid. Another important point which has happened along with this is that now on one side, the number of medical colleges have been increased. That means high tertiary care quality care is now available nearer to your houses. AIIMS have increased from 7 to 22. Again, number of 3. I'm just coming from Deoghar, and Deoghar is a very remote area. It has only recently been connected with air connectivity, but the important is it is center of Santhal Pargana, where 5 districts, at the center of that an AIIMS has been started. And all AIIMS will now provide care for Ayushman Bharat. Another important component which has been brought in recently, besides Ayushman, is under Digital Health Program, Aabha ID. Now, all of us should be having our Aabha ID so that we don't have to carry huge records with us. Everything is deposited into our account with confidentiality, and wherever we go with Aabha ID, the doctor, whoever is looking after, can look at. So, a lot of these, as I said, we have got the confidence now that IT can be used, and even Ayushman card is something which is IT based so that we use it. It is linked with our Aadhaar card. And the whole effort is to make the current health system in the country what we should say as a more comprehensive approach to health. That we are not talking about piecemeal approach to taking care of our health. We are taking care, whether it is eSanjeevani you mentioned about Ayushman Bharat, you also mentioned about the immunization sector, but they are all linked and being given in a manner that it is client friendly. Community is having less difficulty. We have to cover a lot of miles. I don't think that we can say that we are in a perfect stage. There are some states which have shown a lot of improvement, but the fact is that we are moving in that direction. And this whole philosophy is that India should have one of the best health systems very soon for all our people.
Dr. Arora, to add in your opinion, that you mentioned about how we have seen an increase in number of AIIMS from 7 to 23 in last 8 years. I have some data from PIB that also says that we have seen a 97% of increase in the medical seats as well. So can we say that finally India is addressing the parity that we need in patient and professional ratio?
In fact, this is precisely I wanted to say. I will give you some very telling figures, and which is worrisome also, and which gives a lot of now hope. In 2009, I was involved with Medical Council of India, and at that time there were only 28,000 seats in MBBS. In 2014, it became 52,000. And today it is over 100,000 seats. The target is that we should have about 150,000 seats for MBBS. So 1.5 lakh doctors are there. Similarly, PG seats were 13,000. Today we have 65,000. And the whole approach is that in another 3 to 5 years, we should have equal number of PG seats and undergraduate seats. The thinking process is we not only have to have an expanded medical personnel workforce, but the quality of care is improved. And that's why we have new nursing colleges. Every district is also having ASHA, A&M, and this under skill building, a lot of support staff training is taking place. It is estimated that in next 10 years, by 2030, we should have opening for another almost 50 million health personnel, which will take care of not only our population, but we should be able to export this manpower to generate foreign exchange. So this is a very ambitious program, but we are moving in the right direction because our people deserve the best, and there is a high political, I would say, prioritization and political will in this. Investments are being made, private sector is invited, and hopefully we should see more and more better quality of care and available at our doorstep. Another example is health and wellness centers. Health and wellness centers, 150,000 health and wellness centers are there, which is within 2 to 3 kilometers of wherever we are living. And it will provide high quality primary care along with e-Sanjeevani facility so that the person can get tele-consultation from consultation at district level or even at higher level from medical colleges.
To take the discussion forward, my next question is to Dr. Dhamija. It is in context of misinformation. When we talk about mental health, Dr. Dhamija, it is said that we need to identify a patient at the right time. We have to get a professional's consultation at the right time. But what plays a evil's role is misinformation in this, per se WhatsApp forwards, per se untrained self-claimed doctors, what we say jhola chhap in Hindi. What we have seen in general is that people or family who are not able to identify a patient sometimes label them as a lazy person. So how misinformation should be targeted and should not be more promoted?
I think you hit the nail right on its head that we have this social problem of stigma in the mental diseases, not only in the mental disease but also in some of the neurological diseases like epilepsy. And this is a peculiar problem which we are facing in last so many years. But now the political will and the health awareness campaign in last few years, we have seen that mental health literacy is increasing, and particularly COVID has helped us to identify and to sensitize the people that mental health issues are preventable, treatable, and should be taken seriously and taken to the nearest hospital rather than hiding them or not getting them the adequate treatment at the right time. So mental health literacy and destigmatization is the priority area now, and we have seen that not only at the government but also at the social level, the awareness is being increased by various stakeholders, including the mental health professionals, the doctors, the other medical staff, and society in general. So this is something which we have been advocating, and we need patients advocate also, and we need media, whether it is mass media or electronic media or print media, to help us in propagating the message of mental illness is being treatable, and most of these mental illness only need few years of treatment, unlike the chronic diseases like diabetes and hypertension, which needs lifelong or long-term treatment. So obviously the message should be loud and clear, and if you have any mental health issue, please seek professional help, which is available and accessible, and that should be the message through this broadcast also. And as I highlighted the numbers also, 14416 is the telephone number which can be dialed from any corner of the country, and the call will be connected to the nearest Telemanas center, which is centrally operational helpline for these individuals.
Dr. Dhamija, on the same line, when we talk about how we can prioritize healthcare for all as a society, what measures can we follow at individual level to take care of our well-being, both physical and mental?
So, few things which are very important. One is, of course, the diet and nutrition. So, obviously, balanced diet, cutting down the sugar and salt levels and increasing the colored fruits in your diet. So, that is very, very important. in addition to the diet, physical activity or the physical fitness and cognitive fitness both go hand in hand. Most of us would focus on physical fitness, including the brisk walking and the aerobics. So the recommendations are 30 minutes of brisk walk every day, at least for 5 days a week. That means 150 minutes of brisk walking, including the substituting with aerobic exercises. So that is one thing. Second is, of course, the cognitive fitness, which is very, very important for our brain health. And recently in WHO General Assembly in May 2022, the WHO has taken a very important direction to all the 200 member states that the brain health is to be taken as a priority, including epilepsy. It is focused on epilepsy, but brain health in general, and it has asked all the member states to prioritize this health issue in their legislatives and in their budgets. So obviously, India is also signatory to that, and India made a very good presentation at the WHO General Assembly regarding the brain health. So cognitive fitness, as I was telling, is keeping your brain cells or neurons active, either by learning a new language, learning a new hobby, whether it is music or something like that, or being connected socially through either your visual or electronic medias and digital technologies, whether it is WhatsApp or it is the other social media. That way, exercising your brain cells by playing Sudokus or crosswords or puzzles, so that will keep active your brain cells and increasing your cognitive reserve and cognitive fitness. So these two things, one is diet, of course, second is fitness, and third is, of course, lifestyle diseases like avoiding lifestyle habits, including alcohol and tobacco. So no to alcohol, no to tobacco in absolute terms. These are very, very living healthy lifestyles in general for all the society and making the country healthier.
And to add in this, Dr. Arora, I want to understand from you, is the guidelines generally same for people and patients who are suffering from chronic illnesses like diabetes or autoimmune disease like psoriasis, or is it different?
So guidelines are very much similar. I in fact wanted to add on what Dr. Dhamija was saying regarding misinformation, misconception and rumors about mental health and associated stigma. We have learned a lot in immunization sector because same kind of misinformation, rumors is spread fast and people have then start getting doubt about the value of immunization. And similarly, it happens with everything. It is not only mental health, tuberculosis, and some of the other illnesses also, it is the same. And I think we need to follow and we have to learn from behavioral scientists and social scientists how to debunk these misconceptions and misinformation. The second is that we are now taking a very preemptive and a proactive role, that we know that these are the kind of misconceptions circulating in the community, need to break those myths, and that also helps. It gives the people confidence. Now coming to the chronic disease, in fact, mental health is also part of a chronic disease bouquet which all of us are faced at the moment. And exactly what Dr. Dhamija has said, lifestyle is very important. The eating habits are very important. And the third thing is, I think socialization is also helpful. In what sense? That rather than getting stuck on our mobiles, if we have a face-to-face better interaction, it is going back to the kind of drawing board or basics of life is also helpful. But we have to have a very healthy balance between development on one side, which is economic development, but simultaneously social development has to be there and social denigration should not be taking place. Chronic disease, that's why become more complex than just giving some tablets to treat blood pressure or diabetes.
And with these tips from your side, thank you so much, Dr. Dhamija and Dr. Arora, for joining us today on All India Radio.
Thank you very much.
Thank you very much.
You were listening to a discussion on World Health Day 2023, Health for All. The participants were Dr. N.K. Arora, Chairman, National Technical Advisory Group on Immunization, and Dr. Rajendra Dhamija, Director, Institute of Human Behavior and Allied Sciences, and Omvesh Upadhyay, AIR Correspondent. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on Air. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 928 909 4044.